Here we go. And we are live. We are live. We are live. We are live. Hello to Phoenix and everyone else. Thank you for coming to this live interview. And thank you so much for everyone who's been putting those notifications on. You're like, I am waiting for this interview. So thank you so much from the bottom of my heart. We are live with one of the best nurses I know. Her name is Emma, but I will let her introduce herself. So thank you so much, everyone watching. And please let your friends know. Let your friends know that we are live. Let them come in. I want you to journey with me as we delve into where did Emma start her nursing? Where was she working in Kenya? What in the world is she doing in the UK? And what is her passion for midwifery? And finally, we will see what she has to tell us about midwifery. So if you're passionate about midwifery, even if you're a lay person out there wondering one or little things about being a midwife, feel free to ask us questions. So hello, Emma, and introduce yourself to the audience.
Hello, my name is Emma Mwangi. I'm Kenyan, of course. And I have been a nurse since the year 20. I graduated in 2011, so I think I've been a nurse for 12 years, yeah?
Yeah.
14. Oh,
Something like that.
yes. Oh my God, it makes me really old. So,
You're not.
I went to school in Moi University in 2011.
Mhm,
I graduated with a BSc nursing.
mhm,
And my career started with me doing internship. I did internship in Nakuru and
okay,
Kakamega.
mhm,
And then after that,
mhm.
my first career was in reproductive health.
Wow.
And I have always worked in reproductive health.
Mhm,
That includes maternal, neonatal, child health,
okay.
um, and adolescent reproductive health services.
Mhm,
Up until when I came to the UK in 2020.
mhm.
That's when I went back to becoming a nurse.
Okay,
So I did nursing in my internship, then worked in reproductive health organizations in Kenya.
okay.
Uh, at some point, I was known as the family planning nurse. I
Mhm.
won awards in family planning,
Wow.
worldwide awards
Mhm,
for writing uh, future thoughts about how family planning should be programmed.
mhm.
And here I am, back to my
Wow.
first love.
Mhm,
In the United Kingdom, you have to be a midwife for you to delve into the reproductive health world.
mhm.
So I'm back to it.
Wow. Emma, your journey is incredible. This is why I do not like asking my guests questions before I interview them because it makes me not real. Emma, I've never asked you about your journey. You're a witness to that.
Yeah.
And look, I did not even know that you came from Kenya with a BSN. I have absolutely no idea. I was here telling myself, okay, maybe she had a diploma just like any other person. So congratulations. So Emma,
Thank you.
let me ask you, why midwifery? Why did you fall in love with reproductive health and things like that?
So I have a friend. She now works in the US. I'll start with how I became a nurse.
Okay, let's go.
I have a friend who works in the US. When we were choosing courses, Moi University had just started dentistry then.
Okay.
Then she wanted to join dentistry. Then I told her, Sonny, you know what? I think we want to travel the world. Let's stick to nursing
Okay.
so that one day we work outside this country. That was always how we decided to stay in nursing.
Uh-huh.
Then when we went to third year,
Mm-hmm.
um, I remember when we started our obs gain um,
Placement.
not even placement,
Uh-huh.
theoretical in class. I was
Oh, in
like,
class.
wow. Yes, I was
Mm-hmm.
like, wow, I really, really love this topic.
Uh-huh.
And I was so good at it. I used to do
Mm-hmm.
so well in it.
Wow.
So that's where I got the notion that I think I can go this way.
Mm-hmm.
Then we went for placement. Placement,
Mm-hmm.
BSNs, if you were in school
Mm-hmm.
during those days, BSNs were not as serious as the way KRCHNs used to be in placement.
Mm-hmm.
And people didn't even like us.
Uh-huh.
Sometimes you go to placement and nobody even wants to pair with you, so you just hang around
Mm.
following a nurse.
Mm.
But anyway, after I finished and went for my internship,
Mm.
I was in Kakamega doing the MCH part.
Uh-huh.
I loved it, and then I went and did the maternity bit. The
Okay.
maternity bit scared me a bit because uh, if you're a BSN, you'll understand. Sometimes Kenyan nurses
Mhm.
are very cheeky.
Uh-huh.
Sometimes you'll go to work. Huko
Mm.
Kakamega, people used to tell us, you
Mm.
know what?
Mm.
Um, I'm going for funeral tomorrow.
Okay.
So you'll find yourself, you're just with the KRCHN nurses and you're the
Yeah.
only nurse on duty. And
Okay.
Kakamega used to be like a conveyor belt for babies. They
Oh.
just come one after the other.
Oh.
Women just
Oh.
come non-stop, you know.
Mm-hmm.
But anyway, that's how my passion for midwifery came about.
Okay.
Uh, I just wanted to be there for women. I wanted to empower women,
Mm.
and one of the best way to empower women is through
Mm.
reproductive health. If a
Okay.
woman has the choices
Mm.
to choose anything concerning her reproductive health, she
Mm.
has the choices in the world to do anything she can be. That's
Wow.
what I always say.
Mm.
Because if you ask any woman who has a child,
Yeah.
one period of bringing up a pregnancy all the way to 5 years old, it
Mm.
takes a woman back many, many years career wise.
Mm.
So if a woman has time to reproduce and hold on and choose the time she wants to reproduce,
Uh-huh.
it gives her a leverage
Mm.
to steer her career in the direction that she wants to go. So
Wow.
that's exactly how I thought. If I want to empower women, I will empower women in the sector that I'm good in.
Wow. And that is in reproductive health.
Yes. So
Congratulations.
always, yes, I've always been in reproductive health.
So why United Kingdom? Why not
Uh
USA? Because your
honestly,
friend went to USA. Why are you here?
honestly. So I remember when I used to work for a USAID project in Kenya,
Mm-hmm.
and during that time they were resizing. Uh, it was in Kitui, the heart of dryness. It was in an impoverished area.
Okay.
So I used to work there, and they were resizing, and they wanted less staff.
Mm-hmm.
I remember them asking us to volunteer,
Yeah.
them asking us to reapply for jobs,
Uh-huh.
but I volunteered to resign. So
Oh.
for those who know me from Kenya, I bake cakes. I used to bake cakes. I don't bake in United Kingdom anymore. So I used to bake cakes for sale,
Uh-huh.
birthday, wedding cakes, and all that. So I volunteered to resign because of an incident that had happened in the organization,
Okay.
and I felt that the people involved,
Mm.
this was a reproductive health organization,
Mm.
but the incident was, in quotes, sexual harassment, according to me.
Mm.
And the person who was victimized was a lady.
Oh no.
I never got beyond that bit. It was
Mm.
very stressful for me to
Mm.
just forgive and go ahead.
Mm.
I felt I do not belong to this organization. For
Mm.
me, that was the helm of toxicity.
Mm.
So when people are told to reapply for jobs, I offered to resign from the job.
Mm.
And I remember some of the senior staff coming back to me telling me, just reapply for a job. They even called me after like 2 months again
Mm.
to apply for another job
Yeah.
in the same organization. But I was like, no.
No.
So when I went home, I
Mm.
remembered in 2013, I had started the process of going to America,
Oh.
but I shelved it for a moment.
Mm-hmm.
So when I came back uh, during the time I was baking cakes,
Mm.
I said I'm going to restart the process of going to America. So I did CGFNS, I did my IELTS. So
Mm.
during the process of doing my IELTS, I remember those days people used to say IELTS is so hard.
Mm.
Nobody ever passes IELTS. So I went for training in one of those West I went for
Plan.
training in British Council,
Okay.
and then I met a nurse there who I think had done IELTS for 3 times or two.
Mhm.
So we exchanged numbers, and then I told her I'm going to pass this thing. There's no chance I'm going to fail. This is English, yeah?
Yeah. Yeah.
So I went in, and 2 weeks later, when my results came out, I had very nice, outstanding results. I
Wow.
would say yes.
Wow.
I had
Congratulations.
outstanding things. So she told me, you'll take so long in Kenya. Why don't you try and apply for UK process? So I told her, okay, UK is really not my choice.
Yeah.
And that time I had just discovered I was expecting. It was
Wow.
around November when I found out my results. So
Mm.
she told me, why don't you try the UK process? So I went ahead
Yeah.
and tried. I went to a group, uh,
Yeah.
famously then,
Yeah. Yeah.
famously then,
Mm.
where nurses used to all go in and people are coached how to do CBT
Yeah.
and do what.
Mm.
So I was added to the group.
Mm.
And then when I got into the group, there was a
Mm.
gentleman who used to work with me in a different organization.
Uh-huh.
So he saw my name and he was like, wow, you're here. I've
Mm-hmm.
already done my CBT. I'm just waiting for interview. So he
Uh-huh.
called me and asked me to to apply for the NMC, all those things. So he guided me through. In a
Uh-huh.
day, I was able to do that. In
Wow.
7 days, I had
Mm.
had my authority to taste
Yeah.
for CBT.
Yeah.
Then he told me, you don't need to read a lot, just go
Mm.
and do it. So I
Mm.
went and did my CBT, believe it or not.
Mm.
In less than 6 weeks, I was in the UK.
Wow.
So I
Congratulations.
didn't even have the time to um to process the whole situation. I
Yeah.
didn't know anyone in the UK. I even came before the gentleman who took me through the whole
Yeah.
process.
Yeah.
I didn't even have the time to digest this whole process. I was
Mm.
pregnant, I was alone,
Yeah.
I didn't know anyone. I didn't expect the cold will be as cold as it is.
Oh dear.
I,
Mm.
I had in my mind that probably it will be as cold as Limuru.
Yeah. Oh, shock on you.
So I found myself in England, and
Yeah.
that's how I stayed in England.
And may I ask, did you use an agency? Because my audience wants to know, did you use an agency?
Yes, that time we used an agency, MSI,
Okay.
but we used a lady who was an extension to MSI.
Mm.
So she did everything. She was very aggressive in getting clients.
Mm-hmm.
So once she gets you, she gives you a chance to do an interview
Mm.
immediately.
Uh-huh.
So she gave us a chance. I had been called for several interview positions. Thank God, all of them were in London,
Uh-huh.
except one which was in catering. So I'm thinking like, oh my God, I escaped the London hustle. So so that's how I found myself in Portsmouth.
Okay.
Yeah.
And you're
Yeah.
loving it there, you know it.
Oh, I when you grow older, you become a little skeptical when it comes to changes. So
Oh,
I'm very comfortable in Portsmouth,
that's very good.
and it's not very cold, so it's a good thing for me. It's a
And it's
kind of
beautiful,
warm
I
city.
must
Yeah,
add.
it's a very beautiful city. Yeah,
Yeah.
and the hospital, I
Hmm.
was very lucky to work with very beautiful souls.
That's very good. So, Emma,
So it,
here you come as a nurse. What's the transition between being a nurse in the UK and now drifting into midwifery? Because that is what most of my people want to know. At what point did you?
uh, I when I came here, I came as a surgical high care nurse.
Yes.
I worked in I would say like high dependency unit for surgical patients.
Mhm.
So I worked there for almost 3 years or 2 years, 2 years, yeah. So, but they knew that I wanted to go back into maternity.
Mm.
So one time I had started the process of doing CBT and become a midwife in the UK,
Yeah.
like pay for it and do CBT and do OSCE.
Yeah.
But I was thinking
Mm.
there's a huge difference between how how midwifery is. I was thinking, I wasn't sure. I had never been to labor ward in England,
Mm.
except when I was having my baby.
Yeah.
So I didn't know how to approach this. I didn't know the protocols. I didn't know the guidelines. I
Mm.
didn't know anyone who had
And
successfully become
mm.
a midwife in England.
Mm.
So during one time, I was also tired of high dependency. So I
Mm.
got a job with Southampton to go and become a night intensive care unit nurse.
Okay.
And I was still just thinking. Then this post comes up. They're
Mm.
looking for nurses, international nurses. You have to have 2 years experience in nursing. And if you're a newly qualified nurse, you have to have 6 years, 6 months experience.
Mm.
My then manager saw that post,
Mm.
and I had seen it here, but the catch was your manager has to agree.
Yeah.
So when I went to talk to her, she just said, the moment I saw this post, I
And you
just
feel
thought about you.
wow. Oh.
Then she told me, I will
Mm.
support you.
Yeah.
You apply for it.
Yeah.
Go ask the person who's recruiting to give you a tour of
Mm.
the unit. If you like it, apply
Mm.
for it. If you
Mm.
don't, you've not missed a chance. She was an amazing, amazing manager. I
Yeah.
will I'm always indebted to her.
Yeah.
So I went to the unit.
Mm.
Then when I got there, I realized the first time when I came here when I was pregnant, I was the
Yeah.
only there was no black midwives.
Yeah.
It was all white.
Yeah.
But this time I noticed one, two, three black midwives. Then I realized they started
Mm.
an international midwives unit.
Wow.
Yes. So there are some countries like Ghana, Nigeria, which can specifically train you to become a midwife. They don't train BSN or
Mm.
KSCHN the way Kenya does.
Mm.
So people can just start midwifery directly from college. So I realized there was some few, two, three midwives in
Mm.
there.
Mm-hmm.
I asked the coordinator for international midwives how to go about it. Then she told me a long story. It has to go through an agency, not what, go back to band four, and
Mm.
then
Oh.
they'll train you for OSCE.
Mm.
Then the person I had gone to see, she just told me, just apply for it and apply for this. It's a master's degree
Uh-huh.
sponsored by Health Education England,
England, yeah.
and you're still being paid your salary. They're
Mm.
matching your salary,
Mm.
and they train you to be a midwife. You get a master's on top of it.
Wow.
So just apply for it. You have to
Mm.
write an expression of interest, go for
Yeah.
an interview with the university.
Yeah.
So we were lucky, five of us got in. We were the first slot in Portsmouth, but I think it's been happening everywhere.
Mm.
Especially in London. I know in London, in my school, Kingston University,
Mm-hmm.
we have Frimley Hospital, we
Mm.
have uh, Epsom and St
Epsom,
Helium.
Epsom and St.
Yes,
Helier. Yeah.
yes, and then we have uh, Croydon. We
Croydon,
have
yeah.
Kingston itself, Kingston
Yeah.
Hospital. We
Uh-huh.
have St George's. We have Westminster. What's the name?
I don't even know. Uh-huh.
Something Westminster.
Uh-huh.
So there's several, and we also have East Surrey, the Royal
Wow.
Hospital, and we have Berkshire as well.
Wow, that's good.
So we have several people from all those places.
Yeah.
So in our unit, we got 5 slots for nurses converting to become midwives, and that's how
Wow.
I found myself in the program.
Wow.
Yes.
Congratulations,
So
Emma. Wow.
thank you.
That's so
So
impressive. Goodness me.
so that's how I found myself in the program. And
Mhm.
I just have to make it clear.
Mm.
I have done almost all of the program, just remaining with the assessment bit.
Mm.
The program entails 2 years, 24
Mm.
months of both placement and theoretical.
Mhm.
So you have 3 days you go to the university during your unit placement, unit block,
Mm.
and then you have 2 days of online.
Mm-hmm.
and then you have to have placement. So like we go for placement
Yeah.
in Portsmouth. And the
Mm.
placement here is not like the Kenyan placement. When you're in placement, you're
Mm.
basically working. It's serious business.
Mm.
And especially the bit that you've already been a nurse,
Mm.
you cannot just sit back and say, I'm
No,
observing. You work
no, you
hard.
have to. Mm.
Yes.
Wow.
So we go to community, we
Mm-hmm.
go to labor ward, labor and delivery,
Mm.
and we also go to postnatal, antenatal.
The whole
My
lot.
unit,
Mm.
everyone who works in the unit is a midwife.
Wow.
We don't have bridge nurses like some hospitals
Mm.
where there is nurse working in postnatal. So
Yeah.
everyone, even the ones who work in postnatal, they are
The
midwives.
midwives. That's
Yes,
amazing.
yes. And Portsmouth is a big hospital, Queen
Yeah.
Alexandra.
Yeah.
So it's a good place to get the experience. And then I
Mm-hmm.
realized
Mm.
this was the best way for me to get in as a midwife because
Mm.
I can just sit back, lay back, and
Yeah.
relax and watch.
Yeah.
Uh, the things that cause maternal mortality in Kenya
Yeah.
are very much different to what causes maternal mortality in England.
Tell me about it.
The population is equally different.
Uh-huh.
So if in Kenya you'll be worried about iron
PPH.
deficiency,
Mm-hmm.
PPH.
Mm.
In England, we have things that worry us. We worry about smoking women. We
Yeah.
worry about uh, thrombosis
Yeah.
because of the exposures that cause thrombosis, like smoking. You
Yeah.
know, so
Yeah.
it's a whole different population, and
Mm.
the procedures and protocols are also very different.
Mm-hmm.
In Kenya, we do a lot of active birthing. That's
Yeah.
what I would say. So
Mm.
you would see in a labor ward, women are just walking up and down, and you have several women you're looking after. Yeah.
That's true. Yeah.
So once in a while, you just go and listen in, or
Yeah.
if you are lucky to have
Stethoscope.
the sonicade. If
Yeah.
you're
Yeah. Yeah.
lucky to have the sonicade, you
Mm.
just go and listen. T t t t. If the heart is beating very fast, you say, "Oh, that's fine,"
Mm.
because you don't have the time to do every 15 minutes monitoring
No.
for if you have 4 women in labor.
Mm.
Probably there's 3 nurses and there's
Mm.
6 women laboring.
Yeah. True.
You don't have the time to do the proper monitoring.
Monitoring. Yeah.
Yes. And I
Mm.
used to wonder in Kenya when someone delivers, there's lots of blood. I
Yeah.
think it's it's a racial thing. I'm not being biased here,
Mm.
but it's a racial thing. When
Really?
women deliver in Kenya, you will
Mm.
just see blood everywhere. You can attest to that, yeah?
Yeah. Yeah. I've been a midwife myself here.
Yeah, so when I came here and during my first delivery, I was wondering where is the blood?
Mm.
You know, like there's literally no blood.
Really? How does
The
that
blood is
work?
very little.
Uh-huh.
It's it's I tell you, we are more predisposed to having PPH anyway as
Oh,
black
as
women.
Africans. Yeah. Yeah. Yeah.
Yes, as Africans and generally the rest, we are more predisposed to having PPH
Mm.
and preeclampsia and diabetes.
Mm. For the people who are watching, PPH means postpartum hemorrhage. That is
Oh,
bleeding,
sorry.
excessive bleeding that can happen after childbirth. Let's continue.
Yes. So I was very lucky to go in as a student.
Uh-huh.
I can observe, I can learn. Comparing my experience coming in as a nurse
Mm.
internationally and coming in as a midwife student,
Mm.
I prefer the midwife student because of the nurse. You had to
Uh-huh.
catch up very fast.
Yes.
The moment you show up with your blue uniform, you're a
Yeah.
band 5, you're
Yeah.
given a team. So you
Uh-huh.
learn on the job.
Yeah.
But in this case, I am given an opportunity to learn the right way.
Uh-huh.
And on top of it, a master's degree. Who can say no?
Who can say no to that? Please and thank you. Very important. Who can say
So
no
that
to a master's degree?
yes, there's opportunities that keep popping up
Yeah.
about these courses in
Mhm.
different universities, and I see people saying, "Oh, I cannot go back to school.
Mm,
I understand you cannot go back to school, but the thing is,
mm.
it's very important to have choices in life.
Yes.
So once I am finished with this
Yeah.
degree of
Masters.
mine,
Mm,
I can decide I want to work as a midwife, I
yeah.
want to work as a nurse,
Yeah.
or I want to go and become a health visitor, you
Of
know.
course. Of course.
So it's a good thing to have choices in life.
Mm,
Actually,
mm,
that's why I went to reproductive health. It's all
mm.
about choices.
Wow.
When you feel like you don't have choices,
Mm.
it's a very bad place to be.
That's true because it limits your flexibility as
Yeah,
well.
it
Like,
limits your
a quick
flexibilities.
question for you. There are nurses who are watching this and they are wondering, Emma, you got that through Health Education England. If I want to do the same, how do I find it? How do they go about it?
So the thing is, you will still have to do CBT. You'll still have to go and register in NMC
Mm.
the way we did when we were coming in as nurses.
Yeah.
Uh, NMC is flexible with the language now because you're already in here. You have
Yeah.
1 year experience of working in England.
Yeah.
Your manager can write you a letter showing that you've worked here for a year plus.
Yeah.
So you don't have to go back and do IELTS.
Okay.
And you have to do CBT for
Yes.
midwifery.
Mm-hmm.
CBT will, I don't think it will be very hard, but you just have to know a few things. So of course, CBT, they ask you about infection prevention, and
Mm.
then they'll ask you about safeguarding. They
Yeah.
will, in this one, there's no risk for falls. So they will
Okay.
not ask you about that. You will be
Yeah.
lucky.
Okay.
So you just need to familiarize yourself with protocols. There's the Royal College of Nurses, Royal College of Obstetricians
Midwife.
and Gynecologists,
Royal
that
College.
guidelines that
Uh-huh.
govern the midwifery practice in England. So
Okay.
if you go, it's in the NICE guidelines anyway. So if you just click NICE guidelines for intrapartum, it will tell you when women are seen during the intrapartum period, when women are seen during the postpartum period, how
Mm-hmm.
labor is monitored, how
Mm-hmm.
women do birth planning with their midwives, you know. So you
Mm-hmm.
just familiarize yourself. And I know
Mm-hmm.
Kenyans and other nurses, they're very smart.
They
They will
are.
not, yes. So
I
CBT
give
will
it to
not
them.
will be a walk in the park.
100%. I believe so because the other
Yes,
thing that I've noted with CBT is that it just needs you to have some basic knowledge about what you're actually going to go for. So I believe you when you say that they're going to pass first time. I believe you.
yes.
Now, Ems, what if they want to follow the same path that you followed? What do they do? How do they find this master's degree? Because maybe there's a nurse there saying, Aki Kate, do you know what? I really want my master's and I want it paid for, like for Emma. She's not paying even a penny. Kate, I want this. How do I do it? What advice do you have for them, dear?
So there's these posts keep coming up every
Okay.
time. If you go to NHS jobs, you'll
Uh-huh.
find these posts have been posted in several trusts.
Mm-hmm.
So most times, I think I've seen one of the ladies ask me about this. I can't remember her name, but most times they
Mm-hmm.
just go online
Uh-huh.
in NHS jobs websites,
Uh-huh.
especially around September.
Uh-huh.
No, around this time actually, because
Oh.
September is when it starts. So
Uh-huh.
you have to do an interview. If you, they'll ask you to write an expression of interest,
Uh-huh.
and then you'll have to do an interview, and then you'll
So
join the university.
is it coming in as a job or how will it be free
It
on
comes in
NHS?
as a job. It comes in
Oh,
as a job.
really? Mm-hmm.
Yes. So it comes in as
Wow.
a job. It says band five student midwives, nurse to,
Ah.
yes, yes. So it comes in as a job.
Uh-huh. And on the website for Health Education England, do you
No,
reckon they post them there?
not really.
Mm-hmm.
And if you look in your trusts, most times, if your trust offers this kind of jobs,
Mm-hmm.
they'll advertise for them. So
Ah.
I know in Hampshire where we are, there's
Yeah.
Portsmouth, there's
Mm-hmm.
Winchester,
Yeah.
there's Basingstoke.
Mm-hmm.
I'm not sure if Frimley is in Hampshire, but there's Frimley as well
Mm-hmm.
on this side. And
Mm-hmm.
then London has loads of schools that do nurse conversion course. In many universities, we have King's College, we have Kingston University, where I am.
Uh-huh.
So in London, and we have Royal Free Hospital. I saw that post in Royal
Ah,
Free Hospital as well. Yes,
wow, that's interesting.
yes.
Wow.
So
Compared, if you were to compare your experience in Kenya and now in the United Kingdom, what are the key learning points do you think that midwives in Kenya would take away? That's one. And what do you think are the learning points for our UK counterparts as midwives? Because I believe in knowledge exchange. There must be something that we are good at in Kenya, and there must be something that they are good at that we can borrow. I know it's a long shot given that this is a first world country, but there are things you never know. Hit us with it.
I'm telling you, Kate,
Eh,
honestly, I cannot even compare the two,
eh.
because
Mhm.
the UK, we do one-to-one monitoring of labor,
Perfect.
and most times you have a student
Yeah.
and you have continuous monitoring in a room.
Mm, mm,
When they say it's safer to deliver in the UK,
mm,
it is safer. Even when you see the ratios that Black women are
mm,
dying more, they're just ratios. They're not numbers.
mm,
It's much safer to deliver here.
mm,
When you become a midwife here,
mm.
it's very different than being a midwife home. Midwife home is a lot of work, and
Yeah.
people used to be sent there as punishment.
Uh-huh.
So it
Yeah.
involves a lot of
Yeah.
it involves a lot of passion. You
Mm,
have to be very passionate about maternity
yeah.
for you to stay in the maternity unit.
Mm,
But I would say, because in Kenya we do not have a lot of staff, we do not have a lot of commodities. Midwives in Kenya,
mm,
I'm sorry to say this,
mhm,
are
mhm,
a bit, I would say technically they're a bit higher,
mhm.
because we are taught how to do manual removal of placenta.
Yeah.
Here it's a doctor's job. We are taught how to do kiwi.
Yes, we are.
Yes, here it's a doctor's job.
What?
Yes. And a midwife in Kenya, if
Mm,
there's a third degree tear, you will go to theater, but you're the one who's doing the suturing. But
mhm,
the doctors do it here. So I think because it's kind of a WHO thing,
mm.
that people who do not have a lot of resources
Yeah.
get a lot more experience
Yes.
as opposed to here.
Yeah.
So a
Where?
midwife in Kenya has a bigger scope of practice
Yes.
as opposed to here.
A midwife
I
here.
don't. Yes, and I think in Kenya we used to augment labor ourselves. Yeah.
Yes, and we used to rupture the membranes. We used to do everything. I've set up so many centers, my friend.
Yes. Here we
So I'm
still do
comfortable with
that.
it.
We
Yeah.
still rupture membranes,
Uh,
but it has to be doctor led. So you
what?
have to have a review by the doctor to say, okay, now this labor is not progressing well. I think we will have Cinto,
Wait a
or
wait a minute, Emma. So you cannot make that decision.
you
So I
can you
cannot
can
be
think it in
monitoring
your
my
head.
mother and I'm like, this is prolonged labor. Let's do something.
You can think it in your head. I want
Oh,
to
oh my
to
God.
do it. But in Kenya, if you're the one who's monitoring a woman and you know
Mhm.
she's going into prolonged labor,
Hmm.
you can say, you know what, I'm going to give Cinto. You
Yeah.
don't have to ask anyone.
Mm.
Go get your Cinto
And put
on
it up.
top.
Wait a
Yes.
minute. This is interesting. I know the midwives in the house. Any midwife out there, any nurse in Kenya who has worked in maternity, you must be flabbergasted. And you know what? Can you see my expression? I'm like, wait, what?
So
It's
I
interesting. Oh,
so I think it's because we have limited resources, so our
oh
scope
yes.
is widened.
Yeah, very true.
But the thing about England is that
Mm,
a woman has choices.
yeah.
A woman's voice is more heard.
Mm-hmm.
So you have choices. You can say, "Oh my God, I do not want to labor in pain,"
Yeah.
and you have an epidural that's done for you, and you just wait for the baby to come out.
Very good point that you're raising. Can you tell us about pain relief in labor? And I have so many questions. Number one, Does it mean that when people go through natural birth, that is SVD, does it mean that now that is the only way to give birth, that pain is part and parcel of the birthing process? Is it a must, or does pain relief make sense? Can you take me through it? What is your perception now? Because now you're here, you're exposed to these things, and I've heard
I
things like gas in a mask
gas
or
and air,
gas
yes,
in
gas
air.
and air.
I want
Gas
these
and air is
things.
just Entonox.
Tell us things. Women, if you're here and you're watching, this is your moment. Listen.
So in Kenya,
Uh-huh.
you there's no gas and air.
No.
Honestly, where will you get gas
Typically,
and
gas in
air?
air is
Or
what did you say it is? I need to
it's
write it here.
Entonox. It's Entonox.
How do we even spell that? Entonox.
Entonox.
And that is a
Yes.
medication,
Yeah, that's the laughing gas, nitrous oxide.
literally.
Yes. So it doesn't take away the pain. It just helps you to cope with the pain. And
Uh-huh.
because you're breathing it in, it also helps with the breathing in and out, the relaxation. Just
Uh-huh.
tries to take you away from the pain,
Uh-huh.
but you'll still feel the pain.
Okay.
So this is a free world. If you want to labor and feel the pain, go
Yeah.
for it.
Okay.
If you want to do hypnobirthing, which is
Mhm.
the yoga ones, go for it. If you
Okay.
want to have the highest form of pain relief,
Mm-hmm.
even before anything's done for you,
Mm.
go for it, as long as you're eligible to have it.
Okay.
If you want to have a cesarean section and not
Mm.
have a vaginal delivery,
Mm.
it's also an option.
Wow.
So the good thing about this place, women have choices. They have
Choices.
options. Yes,
Mm.
you can say this is what I want when you're doing your birth planning.
Mm-hmm.
Nobody, as long as your compass mentors in the
Yeah.
best interest of yourself and
Mm.
the baby,
Yeah.
go for it.
Wow. That's
So
so
that's
good. Does
yes,
it
so
affect
that's
the
so good.
outcome of the baby? Does it affect the APGAR score and all those other outcomes that we look
So
at in a newborn?
something like epidural does not affect the outcome of the baby. It only
Uh-huh.
prolongs your hospital stay,
Uh-huh.
and it makes your delivery more riskier
Mm-hmm.
because you can't feel your legs, you can't feel yourself,
Mm-hmm.
so you can't feel the urge. The urge is
Mm-hmm.
what makes you want to push the baby out.
Uh-huh.
So most women will not even feel the urge for
Mm-hmm.
pushing.
Uh-huh.
So it increases your chances of having vaginal instrumental deliveries.
Okay.
Yes, but it doesn't have any outcomes on the newborn.
On the
They will
newborn.
just come out okay, yes, because
Okay.
it's really on the mother anyway, working on the nerves.
Yeah.
So it's not crossing the placenta. The
Okay.
only thing that crosses the placenta barrier is pethidine,
Okay.
but pethidine should be given probably 2 to 3 hours before a baby is born.
Okay.
Otherwise, the baby comes out almost asleep,
Oh no. Hmm.
because it crosses the
Placenta.
placenta.
Yeah.
Yeah.
Okay.
So the baby comes out a bit flat, but not as flat, flat, flat.
Uh-huh.
They do tend to pick up here
Mm.
because after they are born, they do a lot of monitoring as well
Okay.
after that.
Mm-hmm.
Yes.
Wow. Emma, now that we are talking about choices, let's go to breastfeeding. Sorry, before I went into Reno nursing, if I
Mm.
give you a short background, I was a midwife. I've been a midwife for 5 years, yeah, before I went into Reno nursing. Actually, my love for the kidneys was born in the delivery room. So I am quite passionate when it comes to midwifery, and we might spend the rest of the day talking about midwifery. Now, let's go back to choices, something that you said, which is very important. Now, specifically on breastfeeding. In Kenya, I would be there saying, oh, breastfeeding is the best. Everyone needs to breastfeed. And actually, people get stigmatized if they are not breastfeeding. For example, a mama could be having a baby in the matatu. And if they are not breastfeeding, everyone would be like, nyonyesha huyo mtoto, breastfeed that baby.
I
And
know.
probably there are reasons why they choose not to breastfeed. So How is the choices aspect of, affecting breastfeeding here in the UK?
So, first of all,
Uh-huh.
NHS encourages women to breastfeed.
Okay.
That's the golden standard rule.
Okay.
A baby needs to be breastfed. There's uh, more advantages for breastfeeding. And if you go to most hospitals,
Mm-hmm.
women are encouraged to breastfeed. So if a woman comes and says, "Oh, I'm going to breastfeed my baby,"
Mm.
midwives and maternity support workers, they all go in
Yeah.
trying to teach how to breastfeed. And
Mm.
there's also breastfeeding initiative midwives.
Yeah.
I remember the first time when I came here and I had my own baby.
Mm.
I had my baby at 33 weeks.
Hmm.
So he was a preemie, and
Oh,
then
mm.
I knew he looked mature but a preemie.
He's a
In
preemie.
Kenya we used to do kangaroo mother care.
Oh,
So
yes.
so I knew every time I went to NICU, I would put him in between my breasts, and
Mm-hmm.
then he will just go and reach. But the nurses who were working in NICU
Mm-hmm.
did not understand that the earlier my baby learns how to breast, they didn't encourage me per
Mm-hmm.
se.
Mm-hmm.
And I was producing lots of milk. So
Mm-hmm.
when the breastfeeding initiative midwife came in and said that I just want to breastfeed my baby, she gave me a cover. She gave me gifts,
Oh,
to
that's nice.
encourage me to
Breastfeed.
breastfeed.
That's good.
Yes. So most times when women say they want to breastfeed, within the 1 hour of delivery, we
Mm.
always try to make sure you have established breastfeeding.
Oh, that's amazing.
Yes.
And my midwifery tutor, the one and only Madam Grace, would be very proud to hear that. She was one of the best midwifery tutors I know. There is something you've said, kangaroo mother care and NICU. I do not like assuming that everyone who watches me is a nurse. So, Emma, what is kangaroo mother care? I don't like assuming. I really don't like assuming because my
Sorry.
my my, my audience is quite varied. It's quite varied. So kangaroo mother care, NICU,
So
what else?
kangaroo mother care is an initiative in Kenya. We do not have the hot cots. I mean, the if a baby is going into hypothermia or is at risk of hypothermia, we encourage continuous skin to uh, skin attachment
Contact?
of mother and contact, yes, of mother and baby.
Mm-hmm.
So in Kenya, you would find units where they do. It's basically just a mother becomes like a kangaroo, puts the
Mm-hmm.
baby in between the breasts, puts a hat on, puts socks on,
Mm-hmm.
naked, skin to skin,
Mm-hmm.
and ties a baby with a wrap.
Mm-hmm.
And then just spends the whole day doing her own things with the baby in there in a
Mm.
warm room. So
Wow.
it encourages bonding.
Mm.
And we saw numbers, women thriving, I
Mm.
mean babies thriving
Mm.
so fast, even premature babies just
Yeah.
thriving without the need to have to have extra support of
Mm.
machines.
Mm.
So that was an innovative way of
Mm.
doing that in Kenya for children who are hypothermic. But
Mm.
they had to meet a criteria. They had to breathe on their own.
Yeah.
Yes.
And can
Uh,
fathers do it, or is it just mothers?
so in Kenya,
Mm.
men, I don't even know where men usually are, but here
Uh-huh.
I have seen men.
Uh-huh.
Men, they stay. They're the birth partners of the.
Wow.
That's something I should applaud the
UK.
population here. Yes,
Mm.
the men come in, stay with the women all the way up to the end,
Wow.
and after the woman has had a baby and maybe she
Mm.
needs some suturing or something,
Mm.
they take over and do the skin to skin.
Oh.
Once the mother is done, it's a very supportive thing. It's so lovely.
Mm. That's
It's very,
amazing.
very lovely. So I understand why when I had my baby,
Mm.
everyone was wondering, where is your partner?
Oh, okay. All right. Uh-huh.
Because
Uh,
it's the norm here.
hmm.
Yes, it's the norm here.
Wow. That's interesting. And thank
And
you
it's
so
it's
much.
very much
Wow.
encouraged.
Mm-hmm.
Like in Kenya, you will tell the man, We were
Mm.
very bad. May God forgive us.
Mm.
That's why they started respectful maternity care, like,
Mm.
eh, can you go out? Can you go out? We want to now deliver, because we assumed that these men are not strong enough to stand there, or
Mm.
maybe it was against our culture for
Mm.
men to be in rooms when women were delivering.
Mm.
But here, men get into the room, they help change the diaper. It's a
Mm.
beautiful thing to see.
Wow. Wow.
Yes.
So those are some of the things we can actually borrow from the UK and
Yes.
apply them
Yes.
to our own
Yes.
culture. Emma,
Even during visits, men
uh-huh,
come in with their wives, and the visits here are more frequent as opposed to home.
that is postnatal and antenatal visits, both. Oh,
Yes,
yeah,
all of them. Yes.
amazing. Let me ask as we wind up, if you were given an opportunity to change one thing about maternity care in Kenya, what would it be?
The first thing I'll change is just make sure that we keep our nurses there,
Okay.
because
Mm.
I promise you, if we are intelligent nurses, we are excellent nurses.
Mm.
That's why you see, um, like Avant, they hold posts in Kenya
Yeah.
to
Mm.
brain drain our nurses.
Mm.
That is the first thing I will do. Keep our nurses in Kenya.
Mm-hmm.
And then make sure that patient to nurse ratio
Mm-hmm.
is good,
Mm-hmm.
so that nurses are not worn out.
Mm-hmm.
Our country is beautiful. It's warm. It's just so unfortunate that
Mm.
economic times have brought us here.
Mm.
So the first thing is I will keep our nurses there,
Okay.
and then ensure that services are available everywhere. I worked in Kitui.
Yeah.
We used to make fun of places that used to be very unreachable. If
Mm.
you know you are going to, uh, we used to have very funny names for those places. I've even forgotten.
Uh-huh.
Deep down, you have to go through rocks and whatnot. And
Oh,
Kitui, during rainy season,
mm.
there's floods. So it becomes very unbearable for people to go all the way to those remote places. But when you
Mm.
get down to the remote places, you realize
Mm.
there's people living in this community.
Mm. Wow.
So, in short, sometimes we have mortalities that are unaccounted for.
Oh dear.
Yes, because
Mm.
there's people living in this community. It's very
Mm.
hard to reach. There's
Mm.
one school, one secondary school, one nursery school,
Oh
I mean,
no.
one primary school,
Mm.
and one little dispensary with one nurse.
Oh no.
This
Mm.
nurse has a little house,
Mm.
very unkempt, next
Mm.
to the dispensary.
Mm. Mm.
This nurse cannot live with his family there, so he has to leave the family.
Mm.
You see? So he has to leave the family in a bigger city, and they
Yeah.
can't they can't work normal days. They have to work 24/7, because when you're sleeping, there's
Yeah.
someone coming in, someone delivering,
Mm.
you
Yeah.
know.
True.
Yes. So
Wow.
to improve those services will be much better. It will make, I know there's good hospitals, there's Aga Khan, there's
Mm.
Kenyatta National Hospitals, where it's in urban areas.
Yeah.
But remember, I
Yeah.
also worked in very remote places. So
Yes, you did. Emma, we are losing you. We are losing you, Emma. We are losing you.
sorry.
It's all right. Uh-huh. Sorry, guys. Are we back, Emma? Sorry. This is an interview. If you're just joining us, we're having Emma, who is a midwife. Emma came from the country that she came from Kenya in 2020 in March. She came in and now she has become a midwife. She's a student midwife, meaning that she's taking her master's degree in midwifery here in the UK in Portsmouth. So she's back. Let's continue.
I think I have to leave you guys.
Oh, really now?
Yes.
I'm so sorry.
Yeah.
Any final words? Any final words before we let you go?
My final words is to the nurses.
Mm,
Because our country did not take care of us and we found ourselves in this situation, make the best use of it.
uh-huh.
Education, it never fades. People say educated people are not rich or what. It gives you another platform. You can be a lecturer, you can be what. It
Mm,
gives you an upper hand.
mm,
So I will encourage people, if you get opportunities to go back to school,
mm,
there's lots of them. Go back to school, make yourselves better in the market. So let's say, for instance, they're looking for a nurse a midwife who has ever been a nurse
mm,
in the UK.
mm.
It already gives me an upper hand.
It does.
So
Yeah.
always put yourself in a situation that there's more that you can offer.
Yeah.
And widen your scope. Your nurses, you can go as far as your eyes can see.
Mm,
If you want to go to Australia,
mm.
even just for work tourism, go for
Yeah.
it.
Why not? Mm-hmm.
Because at the end of the day, we will go back to our homes
Yes.
and we are the ones who are going to ensure that we change the system, we change the policy,
Mm.
and we have the local experience. Now we are getting the
International.
international experience.
That's true.
So when we go home,
Mm.
we have best practices from all over the world.
Yes, we do.
Yes, and we can change our system if
Amen to that.
political environments enable us.
Yeah, very true.
Yes,
Emma, thank you so much. I'll let you go. Thank you so much for even doing this with me. Thank you for the honor of coming to my channel, letting me host you. Thank you for sharing with us your story. This has been spectacular. God bless you. Thank you, thank you, thank you for your words of wisdom.
you're welcome.
Thank you so
Thanks
much.
so much for hosting me as well.
You're most welcome, my girl. And all the best in your exam. Now, graduation tunakam. Sawa?
Oh yes, I will let you
I
know.
am coming for the graduation. Where? Hiya, I have to.
I will let all of you know that I'm
Thank,
graduating.
thank
Then
you
you
so
can
much,
come
Emma.
and celebrate with me.
Of course, I can't forget how you dance. Eh? We once met in a dancing party, and my friend, you destroyed us. Can't wait to dance at your graduation, mommy. Bye bye.
Bye. Thanks so much, Kate.
Okay, bye. Wow, Team Phoenix. Hasn't that been amazing? It was that not just mind blowing. I can't believe that Emma came, and I'm so happy. And you guys have tuned in, you've engaged with me. Thank you. That's my heart going out to you. So thank you so much. And as we wind up, if you're wondering how do I leave the United Kingdom how do I leave Kenya for the United Kingdom? I will leave a link to a course that I have created specifically for nurses seeking to leave Kenya to the United Kingdom. It is a course that will take you from the point where you make that decision. How do you format your CV? How do you search for jobs online? Most of you are telling me, oh, Kate, I cannot get a job. I have been having my CBT, my IELTS exam. They are almost expiring. I can't get a job. I can't get a job. And I'm like, do that course. I have shown you specifically how to get jobs in the NHS, private hospital, nursing homes. I'm your girl. I've done it for you. I've done that because I wish I could have had such a course when I left Kenya for the United Kingdom. It would have given me something that Emma has told us, and that is choices. When you have choices, when you know that I have choices, you become an unstoppable person. So for all nurses, there is this wonderful, amazing course that I will put a link in the description of this video, and feel free to engage with me. And if you have questions, drop me and I will talk to you. Okay. So thank you so much for your patronage. I really appreciate. And until next time, ta-da!